Just a quick question. Are all you guys like on the same state? Just so I can like get an idea.
Oh, so I'm actually from Virginia Beach, like Virginia, and then Sherry's from Florida.
Oh wow.
I'm in Maryland, outside
In
of
Des Moines, Iowa.
Oh
So
wow.
Midwest.
Literally all over the place.
Yes.
Yeah.
And actually, the session has just started, so we can have our little talk at the end, if that's okay. Thank you.
Okay, hi everyone. Welcome back to another session with Pre-Dental Universe. I'm Tiffany, one of the pre-dental students monitoring today's session. We have an exciting presentation today with Dr. Macasaet. And before we begin, we just want to thank the doctor for taking the time to be with us. And with that said, the floor is yours whenever you're ready.
Hi. So hey, my name is Dr. Christopher Macasaet. I'm a general dentist in Sacramento, California. And I just want to say thank you to Pre-Dental Universe for having me on. I mean, they've held a lot of things, and I'm very honored, and it's a really great experience. So I hope you guys get something out of this. When I was making this presentation, I really tried to tailor it to what I would want to know as a pre-dent. And so the case studies, I didn't go too much into detail, but I hope this helps. So yeah, basically, just a broad thing. What I'll discuss is my educational background, my journey in dentistry. We'll talk about a few tips for applying to dental school, my tips on the DAT and a CV and a personal statement, what to look for in a dental school, and then we'll go into the case studies and the little other things. All right. And again, I tried to tailor it to you guys, so I hope this helps. But first off, my educational background. So I went to college at University of the Pacific in Stockton, California. I was a bio major, and then I minored in chemistry. So for those of you that are familiar with UOP, UOP has like an accelerated program. So you can actually finish undergrad in as quick as like 2 years and then go into dental school. So you can do like a 2-3 or 3-3. I wasn't even a part of the program. I was a 4-3. I was just a bio major. I didn't know I wanted to become a dentist until like my second year. So, but it all worked out, and I got to enjoy 4 years of college. And then, so I went to dental school at University of the Pacific in San Francisco. Again, it's a 3-year program. I absolutely loved it there. And then I did a general practice residency at St. Barnabas Hospital in the Bronx. Now, some of you may be wondering, why did you go to a residency? Did you do it because you didn't feel prepared from dental school? And that wasn't it. I felt totally prepared after I left my dental school. I was so happy with it. Like, I would actually donate money back. That's how happy I was. And I went to it because you guys are going to learn in dentistry that there's like 1,000 ways to skin a sheep. That you can do a filling so many ways in a crown. But I wanted to learn how the other side of the country did it. And plus of all, I really liked surgery. And New York does a lot of surgery and a lot of crazy things. So, I mean, cool thing, I was in that residency up until July of last year. And the St. Barnabas Hospital is a level 1 trauma center. So this picture on the lower right, I was actually one of the first people to give the COVID test when the COVID outbreak came out in New York. And then I even monitored the oxygen therapies and intubations for the patients in our hospital. So those are the types of big things that were done there. But yeah, I really liked my residency, and I'd say if you guys have an opportunity to do a residency, I would do it because it's a totally different learning curve when you leave dental school. You have to feel prepared and confident that you can, work on a patient by yourself without anyone looking over you. And doing a residency, especially a general practice one with complex patients, gives you some confidence. All right. So mainly my journey into dentistry. I have a lot of family members in dentistry. I have like all of my dad's side. They even taught in dental schools in Georgetown and everything. That actually didn't motivate me to do dentistry. If ever, it hindered me. But thing is, I always knew I liked art. I always liked science, and I wanted to help people. Those are the three things. So I shadowed literally every profession, and then I still came back to dentistry and loved it. Now, so a big tip for you guys, especially going to your interview, the interviewer will always ask you, no matter where you go, why did you choose dentistry? And I'm going to put my life on the line and bet like half of you are going to say something about hand skills or art, something along those lines. And every school hears that. Now, the big thing when I went to my interviews, I remember I was at my UOP interview, my NYU interview, and my UNLV interview. And they all, when I told them, I like doing art, I like doing this, they said, oh, so you do that. Do you have like a picture of any of the work you've done? And I was actually like, yeah, I actually do on my phone here. So I pulled out my phone and I showed them a picture. And it gave them proof. They're like, okay, he's actually not lying, right? And then it steered the interview away from something so stressful to something more that you have a passion about. It took the ease out of everything. Then you can have a casual conversation. And I mean, honestly, that was like a turning point for my interviews. And I know some of my friends who they work on cars, and they even showed them like pictures of their car and then like how they were working on it. So, I mean, the interview itself, it's always going to be stressful, and any little advantage you can get out of making it easier for you guys, I mean, that helps a lot. And then also for you guys' interview, you just got to be just social with it. Dentistry is like the most social profession, and all the interviewers are going to look at that, because when you see a patient, you're going to have them trust in you, and an interviewer is going to have to trust you, because they're going to put their name on the line to say that you can come to their dental school. But I'll talk more about that later. So my practice, I have 2 private practices. I work at Calvine Family Dental in Elk Grove, California, and Aloha Family Dental in El Dorado Hills, California. So mainly this is my father and I who run the practice. The guy on the right side of the screen is my father. We actually purchased one of the practices the week before everything closed down last year. So that was a little hectic. And then right when I came out of residency, I ran my own practice by myself. It was a very, very tough transition, but a lot of learning experiences from that. And if you guys are interested on how running my own practice is, you guys could always DM me on my Instagram or ask me questions on that. So deciding factors for choosing where I wanted to practice was mainly the location and the type of dentistry. So location-wise, that's why I moved to New York. I wanted to see how the other side of the country was. I've always lived in California. And when I hit my first winter in New York, that's when I knew I couldn't do it. I can't take the cold. So I decided, California's the place for me. And location actually intertwines with the type of dentistry. And I'll give you an example. Where I practice, it's really a lot of fillings, crowns, you do some veneers and implants. I have another friend who he works, I'd say, an hour away from me, hour and a half. But the population demographic's so different that he really doesn't do crowns or veneers or implants. It's mainly like extractions and root canals and fillings. So where you live dictates what you can do. If you lived in Beverly Hills, LA, you guys can imagine it's like Hollywood. You're mainly doing like implants and veneers and all those types of things. So when you guys come out of school and think about, what type of dentistry you want to do, what you'd be happy doing, you should really see how that intertwines with the location. Then factors when looking for a job, there's obviously like the pay is the main thing. And you guys are going to debate this when you come out of dental school, either owning your own practice or an associateship. And that's actually very different from each state. So generally, if you're an associate, you would get, if you lived in New York, you would get about 35% of what you produce. All right. But then if you live, that's New York and Colorado actually. But if you lived in California, it can go as low as 25% of what you produce. So it's like that's like a third of your salary difference for a year. So it's like a huge difference. So that's why location again, and then also, associateship, there are the pros and cons. You get paid less, but you don't have to worry about the office. If you own the office, you are the first one there and the last one to leave. And my days, ever since owning an office, there's some days where I leave at like 5:30 or 6, and then I leave there 5:30 or 6 a.m. and then I leave the office at like 7 a.m. So there's some long days, and it's just something to think about. If you guys have questions on that, you can always just message me. All right, so tips for basically applying to dental school in the DAT. So, obviously a good DAT score is very, very important. I know UOP cuts applications off at a certain point. So, the big question is, how did I prepare for the DAT and what do I recommend? So the first thing, it's called DAT Bootcamp. It's like an online testing software. I'm sure you all have heard of it. And if you haven't, you really should check it out. That is like one of the greatest things. The test questions on there are so similar to the actual test. And I have some friends who just used that for like a month and they got like a 21 and they were fine. So I would easily check that out. Next thing was the DAT Destroyer, basically a spiral notebook, both the math and science editions. That was very, very helpful. I probably did that like 3 times over. Now, my biggest tip is to do as many practice tests as possible. And the reason is what I did, my test was at 8 a.m. And what I did for that entire month before, I literally went to the UOP library, sat down, and took a practice test at 8 a.m. every day for a month. Now, you guys must be thinking this guy is like literally crazy. But the reason I did it was because I promise you, when you go to that testing center, you will be so stressed, no matter what situation. It's gonna be stressful. But why I did it was because if I took a test at 8 a.m. every day, then it's just like another day. All right, it's just normal. You take some edge off and you feel just a little more relaxed. Like, hey, I can do this. I've done this plenty of times, right? And if I didn't go well, I tried as hard as I could. Like, there's nothing I could be mad about. And that's what I mainly did. I just took a lot of practice tests and I'm in dental. I went through dental school. It worked out, right? And then if you're looking for more tests, there's this thing called the DAT Achiever. I wouldn't say it's necessary. It's definitely the hardest test out there. I remember when I got the boot camp test, I did like a 24, and then I took the Achiever test. I got like a 16, and I felt demoralized. But if you get like a 17 on that test, it translates to like a 22 or 23. So if you were looking for more, you could do that. This Organic Chemistry as a second language book. It's a blue cover. By far, for me, the best thing for OChem, and I did not like OChem. I read that book like 3 times over. It's an easy read, and that helped a lot. Now, for your CV and personal statement, I've actually had a lot of people like DM me about this. So mainly, I want you to think of your guys' attention span. Like if you're reading someone's essay, you probably blank out at least by the third paragraph, right? So the people reading your applications are going to do the same thing. And I can confidently say I know some people at UOP who read the applications and they blank out after a while and they kind of just scroll over. So I always say you got to limit it, both of them, to like one page. Like you don't have to put any of that fluff in there, at least for your CV, right? Just put like the main things, and the personal statement, just limit it to a page. Limit to a page, make it concise, and get your point across. That's the big thing. Because the last thing you want is for them to see like a 3-page, 2-page long thing, and they're like, I'm not even going to read this because I won't get halfway. So that's like a big mistake. I know that happens with people. And then again, extracurriculars. So I had, I drew, I had drawing, but then also I always tell pre-dents to do something like in research or in school that applies manual dexterity. So for me, I got lucky. I did research at like an anatomy lab, and I did micro dissections on these things called ostracods, and that really helped for me. I know a lot of people have like clubs for cars and all those types of stuff, but basically the extracurriculars at least helps a little, especially with the interview, to get the train of thought. So again, another tip is when you go to the dental school, this is your time to really ask the students how they like it. Do they feel prepared? And some of you may be thinking, I'm just happy to get into a dental school, right? Like it's just so nerve-wracking. But you're going to pay like $500,000, okay? You better be sure that you like it and you get as much out of it, or you're going to regret it. Because I promise you, there are some people who come out of some schools who don't feel prepared when they leave. And you $500,000, you want to feel prepared. So when you go there, I want you to ask them like, how many crowns did you do? How many extractions? How many root canals? All that stuff. And literally take a note when you go there, because I promise you, the different schools you go to will have different numbers, and it'll be drastic. And I'll give you an example of mine is like at UOP, I must have done definitely over 150 extractions by far. I've taken easily over 150 teeth in 2 years of clinic. And I know some people who, when they left dental school, they took out like 10, right? So if you don't get that experience in dental school, where are you going to get it? You probably will, end up never doing it, that procedure, and you'll just refer them all out. I have friends that they didn't do enough root canals in dental school, and they just never do it. Same thing with extractions. They get too scared. They don't have the confidence. They don't do it. So if you're paying $500,000, you definitely want to have the confidence to do something. So a tip with that is generally schools with many specialty programs, that hinders the amount of experience that you can get. So I will give you this as an example for you guys. So let's say a patient walks through your door. They have pain on their tooth. They need it taken out. Who do you think is going to take out the tooth? You, the dental student, right? Or the oral surgery resident that's studying their entire life to take out teeth. Or if someone comes in with pain and they need a root canal, do you think you are going to do the root canal, the first year dental student, second year dental student, or the endo resident who's paying and studying to do root canals their entire life? 9 out of 10 times, it will be the resident. And that's what happens to a lot of students in dental school. At first, they think, hey, they have a lot of specialty programs. This will help me. And then sometimes they come out of it and they regret it. And then they never end up doing the procedure and they never get the confidence. So really, take note of that when you go to your dental school. But if you go into your dental school and already know you want to specialize, definitely go to one that gives you the opportunity to do that. So like another example, at UOP, we have no in-house oral surgery program or pedo specialty. So for me, I got to take out a lot of teeth. But also with pedo, we all got to see our children patients, every single one. And whether we liked children or not, we got a great pedo experience, okay? And we have a lot of pedodontists come out of the school, and they have strong resumes to where, obviously, if you're applying for like an oral surgery residency, the oral surgery residency is, who are they going to choose? The person who has great grades but only took out 10 teeth, or good grades but they took out like 200 teeth. Probably choose the 200 teeth. Okay, so really keep that in mind if you already know what you want to do. And then always, will I like this location? You're going to be there for like 3 to 4 years. There are going to be some tough times, so you better be sure you like it there. And I mean, that's why I chose UOP. I couldn't do a winter for 4 years, so I decided to stay in California. But yeah, just keep those things in mind. So my basic work day, I mainly do like fillings and crowns, and then I'll do root canals, Invisalign, and implants. And for those of you who don't know what those certain things are, we'll talk about it in the next few slides. I generally have 2 hygienists at my office, so I'm managing their patients and my patients for the most part. But we can talk more about that, or if you have questions. So for the basics of an implant, really, this is a case I did in my residency. And I mean, I love implants. So here you can just see, this is actually the bone. So I flapped back the gum. We placed these few implants here. We did a few sutures. And then after a while, they healed. We took an impression, and then he got his new teeth. So, I mean, for me, that's why I did residency. I love surgery. I love implants. And if you don't have to hurt any of the other teeth, I think it's great. So before we get into the case studies, I want to talk about the basics of an X-ray. That way we have a background, okay? So when a dentist takes an X-ray, the tooth's hard mineralized tissues will block some of the radiation aimed at it, making it whiter in appearance. So if it's very dense, it's more white. An X-ray shoots a beam. If it doesn't go through, it makes it more white. So for example, the paper white on your tooth that you see, that's enamel. And then obviously it's one of the densest things in your body. Then over here, this is your bone. Obviously one of the densest things in your body. So it'll be pretty white. Now the tooth's less mineralized tissues will block less of the radiation aimed at it, making it darker in appearance. So if it's not as dense, X-ray can go through more, makes it more dark. So more dense is lighter, less dense is darker. So for example, this grayish portion right here, that's less dense, that's your dentin. And the way I always tell patients is your enamel is like your first layer of skin, very, very strong, very, very tough. But then that second layer, let's say your sibling scratches you and then it hurts like crazy, that's your dentin. Okay, a little more sensitive, a little more prone to getting hurt. Now the black in the background, that's the darkest thing in the picture, that's just space. Basically the X-ray beam never hit anything. And then over here, the thing inside your tooth, that's what we call the pulp chamber. Basically carries the nerves and arteries of your tooth. It's the soft tissue. That means it's less dense. Now, how do we determine cavities? So bacteria make cavities by producing acids, obviously, that eat away parts of the teeth. So if a cavity eats away part of a tooth, it's less mineralized. There's less tooth there. And if there's less tooth there, it appears darker. So then here we see the classic sign of a cavity. It's this like black triangle look over here, okay? So that's how we're able to tell cavities. Generally, they're black triangles in the enamel. Once they hit the dentin, they spread like crazy. So pretty much once it passes this line, it's the point of no return. Anything before that, we generally watch, say it's savable. If you floss, it won't get bigger. But that's the basics. So again, going forward, if it's white, it's very dense. If it's black, it's less dense, and cavities eat at the tooth and then make it darker. All right, so let's talk about some case studies. And again, I made this extremely bare bones, just so it's easier. So a root canal is a treatment for the infected nerve of the tooth. So basically, that portion we showed before, the canal of the tooth holds the nerve. And then in order to clean it, we clean it out and fill it with this thing called gutta percha, which is this filling material, basically these rubber rods on the bottom right. Okay. So with this patient, she was a 15-year-old. She came to my dental school saying that she was in pain when she was biting on her upper right tooth, that her dentist did a filling a long time ago. So I want you guys to look over here. You see this cloudyish white. Now that doesn't look like your enamel. That's actually a filling. Okay. So it doesn't look like this. It's just a little different. It's a filling. But however, you see this filling's like touching the nerve. Okay. So pretty much what's happened is that the filling was so deep that it kept poking at the nerve. So same thing if you had a wound and I was just poking at it like all day, forever. It's very irritating. And what happens to the nerve? It dies. When it dies, an infection forms. And what's happened is that infection has traveled down the root of the tooth out the bottom. Now let's look at the tooth together. You see like a little dark spot here, right? Now remember from our x-ray, we said dark, less dense, okay? And we remember from the cavities eat away at the tooth and make it darker. But you're thinking, oh, well, how could a cavity be all the way down here? It's not technically a cavity, it's an infection. So bacteria that are actually not eating away at the tooth, they're eating away at the jawbone at the top. So what this girl is doing every time she bites, she's literally just hitting this bacteria over and over again. That's what's causing her all this pain. So, what are we going to do? What I did, I basically went into the nerve of the tooth, cleaned it out with a few files, and then filled it with that rubber material on the right side right here. And then you can see it's very white, it's very dense. It seals it up kind of like a cork on a wine glass. Okay, the infection doesn't spread, it's contained in the tooth, everything's cleaned. And then because you took out the nerve, she's not in any more pain. So that is basically the bare bones of a root canal there. So for our next case, this is a single implant case. I absolutely love these things. So an implant, it's a titanium screw that's osseointegrated into bone. Now, when I mean osseointegrated, basically the screw has threads. You place it into the bone, and the bone heals around the threads over time. Generally, this is like 2 to 6 months. Once the implant is stabilized, it's uncovered, and an abutment is placed on the tooth to keep it open and the tissues to stay back. Then an impression is taken and sent to the lab for fabrication of the crown. So the impressions to tell the lab, what should the tooth look like? Where is this implant? How big should the tooth be? Then we get a crown from the lab and we screw it on and the patient has another tooth. And again, I think these things are great. I'll talk more about it in the crown section, but I mean, they're awesome. I love implants. So this is the X-ray form of what happens with an implant. And again, we went over our X-ray basics. So this is the bone, right? And we see the teeth here. We see some space. But what's this pole thing right here? So what happens when I drill into the bone? I want to make sure that the angle is okay, right? We don't want it like going 45 degrees to the right. Patient will hate us. So I drill into the bone. I place a little pin in there to see if it's all right. Now, when I look at my X-ray on the upper left, I see, it's a little to the left, right? So then I move it a little to the right, and then boom, straight up and down. Then we wait, 2 to 6 months. Here I waited about 3, and then we uncover it and place the healing abutment over there. And then after a few more weeks, we place what we call an impression coping, basically to this metal rod on the top. Take an impression of that, send it to the lab, and then we get a crown on a model, and then we screw it right on. And again, we don't touch the other teeth. Patient gets a new tooth there that they never had. So it's really, really great. And then obviously you can see the bone here has healed around the threads of the implants. So this is basically a full mouth rehab case. This is one of the biggest cases I had in dental school. So basically this patient came in, 75-year-old male, saying I have some missing spaces in my mouth that I want filled. Now, there's a lot going on here, but I want you guys to take in mind that this patient didn't have teeth for a long time. He actually told me he didn't eat an apple. He couldn't eat an apple for 35 years because he had no front teeth. So here we did 8 implants, 1 crown, and 12 implant crowns. If you're interested in the nitty-gritties of this, you can DM me about it. But basically, I want you guys to take away that, being a dentist, you're really blessed to not only change the way a person smiles, but how they function, their quality of life. Like I said, can you imagine having not eaten an apple for 35 years? Like, that's just crazy. But the more complex things get, generally the more stressful things get. There's like a lot of things to worry about than just teeth. And it's very rewarding, but I definitely say when you're in dental school, try everything, and I mean everything. That way you know what you like and what you don't like. Because if you try it when you're outside of dental school and then you realizing you don't like it, most likely the patient didn't like the experience either, okay? So, I tried everything in dental school, so I know my limits and everything, and that's why I did residency too. So I say, before you go out there, do everything, and you'll really, really be happy you did. All right, so this is a crown and bridge case, okay? So basically, a crown is, in other words, a cover or a cap that's placed over the tooth and restores a damaged or missing tooth to normal shape and size. So here we see that this part of the tooth is broken, right? Now, how do we determine a filling from a crown? Basically, a crown, you place it when the filling, the missing portion of the tooth, is going to be too big that the patient will either break it off or it's going to do more harm than good. Okay. Now, the thing about a crown is that you have to reshape the tooth, basically shave it down so that it fits this new tooth, this new crown on there. And then they get a new crown. So a bridge is basically shaving 2 teeth, one side and on the other, just like kind of the Golden Gate Bridge behind me. And then you place the bridge on to fit a tooth in the middle. Now, the reason I like implants so much is because I don't have to touch the other 2 teeth. okay? And I always use this analogy with patients because they're choosing prices and they always choose the cheaper one if they can. But the thing is, if you ever got knee surgery, okay, we can all agree that your knee is never going to be the same. You're always more prone to hurting it. You'll never walk the same. And, if you don't have to get the surgery, you don't. The same goes when you cut a tooth. Nothing is better than your enamel. If you cut a tooth, it's never the same. No matter what anyone says, you will always be more prone to a cavity and more prone to getting more dental work done. So if I can save a tooth, I will save a tooth. That's what I tell them. So basically, this patient over here was a 60-year-old male, and he was a smoker. Now, smokers are a huge red flag for implants because smoking inhibits basically bone growth. Your bone shrinks very quickly, and you heal extremely slowly. Okay. And he lost his front teeth in an accident. So, cool, well, not cool, but just fact about this guy, he came to my dental school. He was an oboe player for the San Francisco Orchestra. And the oboe is like a double reed instrument. So you need your front teeth. He came in and, he couldn't play the oboe anymore. His livelihood was taken away from him. And he even had implants in the past, but they failed twice. And dentistry, when something fails twice, you don't do it a third time. It's pretty much game over from there. So if we couldn't do implants, what was the next best thing? We gave him the option of a denture, but he couldn't play the oboe with a denture. So what we did a bridge from canine to canine on the top and the bottom. And then they're fixed. We gave him new teeth, and he was really happy. He was really, really happy. And I was really happy for him because, he got to do his job again. Now, this goes back to a tip for you guys' interview and for life going into dentistry. I said dentistry is the most social profession, right? All these patients that I had the honor of helping, none of them would have ever let me close to their mouth if they didn't trust me. Okay. And you have to be able to build that relationship with them, just listen to them or something. And empathy. And that's the same thing with your interview. I know so many people from UOP that they had great grades, they had a good DAT score, but they couldn't keep a conversation alive to save their life. Okay. And that's what the interview changes about people and dictates things. And there are people with not as good DAT scores and not as good grades, but they could make people smile. They could interact with the interviewer, and they got in. So that's the big thing about your interview. Okay, you just want to be yourself. You want to practice it, and you always want to keep smiling, but you want to engage. You will always want to be talking to people. Back in college, I would help some pre-dents, and they would ask me about the interview, and I even challenged one to walk around the campus and just at least one person a day just introduce themselves, say hi, just sit down. Maybe you kind of know them in class and do a conversation. Because the first, I'd say 3 times, it's pretty tough, right? But after a while, you kind of get into the swing of things. So that will help for your interview. And that helped him. He got into dental school and he wasn't the most social person. So you guys should try that. But, yeah, thank you for having me.
Thank you so much, Dr. Chris, for this amazing presentation and for explaining things very simple to us as pre-dents. We really appreciate your time and the effort you put into preparing this. If you don't mind, we have a couple questions that the audience have.
Yeah, of course.
Okay, and the first question is, what is the difference between a resume and CV, and how do you format this for dental school application?
I'll be totally honest with you. I don't really know the logistics because it's been so long. But I definitely know, I think a CV is more concise. I know my friends who had a resume was a lot longer. I would look it up, but I know a lot of people just use CVs. And at least through UOP, that was the main thing they kind of just wanted. I think this, whichever one's shorter, I think the CV is the shorter one. Because I think the resume was like, you would put, say you did research, right, at a bio lab, then you'd explain in little bullet points the research or how many hours you did. And you just generally just wanted to a page, personally. I remember when I made my first one, I made it like really long. And my friend was like, no, you have to cut it all out. So I don't know necessarily how to format it, but I think that's the bare bones of it.
Okay, thank you, Dr. Macasaet. So the next question is, did you ever consider specializing, as you said you were interested in oral surgery, and like what deterred you from doing so?
Yeah, I did think of specializing, and it was oral surgery, but what deterred me? So when I worked at St. Barnabas Hospital, we were an oral surgery team basically. So we had like Grey's Anatomy, like a call phone, and oral surgery, you guys may not realize it, deals with all the traumas, anything, the shoulder and above. So while I was in the Bronx, I have sutured a lot of ears, I've sutured a lot of faces and lacerations. And the thing about that is it gets pretty tough, but also you have to do it at like 1:30 in the morning sometimes. So that kind of hindered me from it. I didn't like trauma as much or waking up to do it. But also I'd say I knew a little late. And this is another tip for you guys. Like for me, I didn't, at least my first year, I didn't go in and like shadow the oral surgeons. So I didn't know I wanted oral surgery, or I liked it even till like middle of my second year. And UOP's a 3-year program. By that point, you're already applying, right? You already have taken the test. While all my other friends, they shadowed at the beginning, and then they knew, hey, okay, I want to be an oral surgeon. So then they went for it. So for me, I knew a little late. And then the trauma, that was just a little much. It takes a lot of hours. So I think those are the main two things. I'm still thinking about it, but we'll see.
Thank you, Dr. Macasaet. So another following question, it would be, could you talk more about courses that students can take prior to taking their DAT test?
I think I really talked about all of them. You could do, I absolutely recommend the DAT bootcamp, 100%. There's even a schedule there. There's a PDF schedule that you can look up that the guy Ari like sums it up. He's like, you should read these books and watch these videos on this day. And it goes day by day up until the test. But the thing I did is I basically put 2 days in one, because to do that first day that Ari says to do, it'd probably take like 3 or 4 hours. And then the rest of that time, you're just doing nothing. So I put 2 days in one and I committed to that. And that's what I did. And then again, I say, do as many tests as possible, really. I purchased those like old tests back in 2009 that the ADA lets you have. That helped. The DAT Achiever, I just did that to get more tests. And then another thing I did, which I'd recommend, you're going to run out of tests. I use the destroyer, like the math destroyer and the science destroyer. And I forget how many questions are in like the bio section, the chem section, but I would take like 20 questions from bio and like 20 questions from chem in the destroyer and make that into my own test and kind of just time myself. And that's what I did. So that way I didn't have to keep purchasing tests because it just got so expensive. But that was actually really, really good. And if you can do a timed test with the destroyer questions, you guys will get into dental school and you'll be okay.
All right, thank you, Dr. Macasaet. Actually, like hearing about doing a frequent amount of tests, like I feel like that's like a good like to solidify your, I guess, test taking skills because you're under time pressure. So I feel like that's a really good skill to have, especially. And another
Yeah.
question in the chat is, what other like dental schools did you apply to besides UCSF, and like what attracted you to them?
Give me 1 second. Sorry. Sorry. 1 second. So you said instead of UCSF, right?
Yep. What other schools did you apply to?
So I went to UOP. I also applied to a lot in California, and then after that, I mainly applied to New York, and yeah. So those are the ones I applied to. And then what was the other question exactly? Just the ones I applied, or
Like what attracted you to them? Like for
I
applying?
I really wanted to live in California. So that was my thing. And also, when I was going around to the dental schools, uh, I wanted to feel like I was at home. I wanted to feel like I knew that the professors cared about me. So when I went, I know I'm not going to say which ones I went to, but definitely when I went to some schools in the East and some schools in SoCal, I didn't feel that type of vibe personally. The thing is, when I went to UOP, I don't know, you could absolutely tell that the professors really cared about you. And a lot of students were happy, and none of them were like really regretting it. Even though they were stressed, they were like, they never said I wouldn't do it again, right? So that was the big thing with me. I knew that they cared, and if ever at UOP the students have too much power, I'd say, and like even there was a finals week where someone was so stressed that they asked for a ping pong table, and they got a ping pong table within like 3 days in like the student lounge. So it's like that's how much like they care. So mainly clinical experience for me, and then being known that they care about you. And UOP has great clinical experience for sure. But yeah.
Thank you, Dr. Macasaet. Another question is, do dental schools offer opportunities to shadow specialties clinics once you're a dental student, or do you have to search for shadowing opportunities in like other places?
You were saying dental clinics outside of dental school or dental clinics in dental school?
In dental school, like if you're a dental student, do you have to shadow in the clinic, like in the dental school, or find opportunities outside of school?
For us, we were just required to shadow in our dental school. So we were given a paper, and you were supposed to get it signed for a certain amount of hours. And so we kind of just dispersed. I did a few hours in oral surgery, but not much. And then I did a few hours in like endo and all those types of things. So generally, that's what they have you do your first year. But that amount of shadowing is like, I would say it's not enough for you to get a good feel to know you'd want to do it the rest of your life. And you can imagine like 10 students crowding around one patient trying to see what's going on. You're kind of just standing there. So I'd say it's best when it's maybe you and one other person max, and you really get to be up there, ask a lot of questions, and get to know and think if you can do this the rest of your life. Because I had one friend who, that's what he did. He shadowed oral surgery. He liked it so much, he went in every day. And by the time he went in to actually do his first extraction, he knew more than a fourth year, which was like hilarious because he was actually teaching the fourth year when he was a second year. So that's kind of the things you can get.
Thank you, Dr. Macasaet. And the next question is, how were interviews like for you in terms of like the different formats, like MMI or one-on-one? And do you have any more advice about this?
Yeah, so I can even talk about a few schools. So interviews for me, UOP was one-on-one. I'd say it lasted like 45 minutes to an hour for that interview because we were talking a lot. That UOP is very casual. They basically just want to see if you can talk and keep up a conversation. They'll never ask you anything crazy, I'd say. It's very friendly. And then I went to I think it was USC. That one's like a group, and then you have to brainstorm about something and work together, and then there's a scenario. And then they're mainly one-on-one, I'd say. The only one that was actually more than two people talking to me, or more than one person, was Tufts. That one was real tough for me. There was 3 people, and each one was asking a question, and I was scrambling for a while. But yeah, I think that's the only one that was a group. All the other ones, at least in California, they were all single. UNLV was a single person, NYU, single person, Loma Linda, all those ones. They were all single people. But most of all, they're all pretty chill for the most part. I say UOP was the nicest, and USC was the most different one for sure. But for overall, it's all about how you can keep a conversation. Sometimes they'll throw you a curveball with a case study and ask you what you would do in the situation, like an ethical question about something about a filling and if you would do it or not. I forget. But that's so rare, I wouldn't focus on that. Really, if you have a good foundation, if you can smile, if you can socialize, you guys will be great. And then, yeah, that's my big thing with that.
Okay, thank you. So what do you do to find challenging about your profession? What do you find challenging about it?
Oh, man. Now it's not about, dentistry's not hard anymore, I'd say. At some point, prepping crowns gets easier, doing fillings, second nature. The hand skills is second nature. Now it's about patience. It's all about patience and socializing with them, having them like you and remembering them and building a relationship. I was actually just talking about this with my friend, was that it's not what I thought it'd be coming out of school. I thought it would just be big procedures. I would just be focused on the dentistry, but it's more about building the relationship. Okay. And the thing about dentistry that you guys should really consider that's different than a specialty is that you are married to the patient when you do something. You are married to the patient for a specialty, but I'd say for only a period of time. Because you're going to see your patient every 6 months, and they're going to remember what you did for every 6 months. And it could be a good thing or it can be a bad thing, right? And you have to remember, their life, their kids. You don't want to get their kid's name wrong, or God forbid their name wrong, right? So I think that's honestly the most difficult part, because you'll have so many patients, you'll forget a lot of things. But and I write so many things about them, but it's about building that relationship and letting them know that you actually care about them. Because the patients that know that you do care about them, because I'll say hey, how are your kids? How are they doing in football? And they'll be oh man, you remembered, right? No one would usually remember. So that changes everything. So really, I'd say that's the toughest thing. And then there's some patients who are really hard to deal with, who no matter how hard you try, they're just grumpy every day. That's the worst thing, I'd say. But mainly the patience is the toughest thing. Yeah.
All right. Thank you for your unique advice, I would say. Similar question. How do you balance work and your social life then?
You honestly get less. So as you get older, you get more money, but less time, for sure. So now, because I own my own office and I work so many hours, I really just, at night, it's pretty much just I go to the gym and then I wait for the next day. That's pretty much it for the most part. Or I study something in dentistry. The weekends I leave to myself and I'll hang out with a few friends if I'm not doing anything else. But I mean, I'd say that's honestly it for the most part. And that's how most of my friends are right now, at least during COVID for dentistry. So, I mean, that's pretty much it. You, when you get older, you have to sleep less and kind of make more time for yourself. That's kind of what happens. Like nowadays, before an early day of work, I'll actually run at like 5 a.m. before I go. So it kind of changes things. So that's why I say enjoy undergrad and enjoy dental school. Because in undergrad, you can't wait to go to dental school. Then dental school, you can't wait to be a dentist. But then you always look back and you're like, man, that was actually a fun time.
Thank you, Dr. Macasaet. So the next question is, if a student is interested in specializing, besides shadowing more in the field of interest, like, is there anything else you recommend doing to be more competitive?
I would say doing a lot of that procedure and coming up with a portfolio for it. That's definitely one. I know for endo, there are people who take a picture and document all their endo cases and they'll present it. They'll keep it on like a USB drive for like 2 years and build it up. For oral surgery, they pretty much do the same thing about the big cases that they do. That's the main difference because everything else is letters of rec and test scores for the most part. But also for the letters of rec, I say if you're going to specialize, get close to the specialists in your school. Like if you're going to do oral surgery, you better hope that the head of oral surgery loves you at your school and can write a good letter. Or same with endo. Those are the types of things. So building good relationships and then keeping a portfolio of it.
And thank you, Doctor. One more question that we have is, how do you manage your loans, like student loans?
Oh, you guys are gonna hate me. I don't have any because of my parents paid for it, so I kind of got lucky on that part. Yeah, so I can't even answer you on that one.
Okay.
Well, thank you for being honest with us. Another question is, how did you determine what GPR was for you in terms of the curriculum?
For me, I determined it. I asked a lot of my alumni that went to certain GPRs how their experience was. And you guys are going to realize that, especially when you apply to dental school and your GPRs, they'll say they do certain things, but they really don't. Like they'll say, oh, we placed implants, and then you'll ask the resident, and they only placed like 2. But it's like, oh yeah, they actually do place implants. So I asked my alumni, I asked former residents of certain GPRs, and kind of got a feel of what they got to do. And at St. Barnabas, I went to visit it, and there was one girl who placed like 20 implants. So I was like, this is the most out of every single residency I've been to. And then she said she loved it, she didn't regret it. And there was like another residency in Brooklyn who they had placed 20, but then they had like no mentorship. They basically did on their own. So really the best tool you have for dental school and your GPR are the people that went there, the students and the residents, because they'll tell you what's real. Honestly, the teachers and the chairman of the residencies or the dental schools, I mean, usually they want you to come, so they'll try and sell it to you. But the residents will tell you the truth. So that's what I did.
How did you come in contact with like the residents and individuals who went to the schools?
For the residencies, at least for UOP, we have a residency like directory. It kind of tells you for, let's say, because I graduate, like the class ahead of me, there was like a full list of all the residencies and who went there. So I contacted them. And we had a lot of residents for St. Barnabas that went there every year. So I asked them how it was. And then for the other residencies, I asked the resident director to give me the number of a resident. And I asked them. And then, or I had asked friends if they knew anyone who went here, and generally that's kind of how it happened for the most part. I also looked on like Student Doctor Network, but that wasn't a lot of help. So those two things were pretty much what I did.
Well, thank you so much, Dr. Macasaet, for tonight's session. This is the end of the session. We've answered all the questions in the chat. We thank you once again for your time and appreciate all the efforts that you put into helping pre-dental students like us.
Yeah, of course. And I'm really thank you for having me. If you guys have any questions, just feel free to you can DM me on Instagram and I'll help you guys.
Yes, everyone make sure to follow Dr. Macasaet on his Instagram and feel free to email him if you have any other questions. And the quiz will be posted on the GroupMe chat. You guys have 24 hours to take it. Again, thank you all for attending tonight's session. I hope you have a great night.